Hello all, welcome to Medical Equipment Explained. If you've ever wondered how the equipment used on you works, this is for you. Today's topic of discussion is going to be that of ECG, or electrocardiography. Electrocardiography is the process of producing an electrocardiogram, which is the graph of voltage versus time of the electrical activity of the heart using electrodes that are placed on the skin. These electrodes detect a small voltage change that are the consequences of the cardiac muscle depolarizing and repolarizing during each heartbeat. Changes in the normal ECG pattern occur in numerous cardiac abnormalities, such as inadequate blood flow around the heart or electrolyte disturbances. Electrodes are placed on the patient's limbs and on the surface of the chest. The overall magnitude of the heart's electrical potential is then measured from 12 different angles, which are called leads. This is recorded over a period of time, usually around 10 seconds. In this way, the overall magnitude and detection of the heart's electrical depolarization is captured at the moment in the cardiac cycle. There are three main components to an ECG. The P wave, which represents the depolarization of the arteria, the QRS complex, which represents the depolarization of the ventricles, and the T wave, which represents repolarization of those ventricles. During a normal heartbeat, a healthy heart has an orderly progression of depolarization, which starts at the pacemaker cells in the SA node. It spreads throughout the atrium and passes into the AV node, down to the bundle of His, into the Purkinje fibers, and spreading throughout all the ventricles. This orderly pattern of depolarization gives the rise to the characteristics of ECG tracing. To a trained clinician, an ECG conveys a large amount of information about the structure of the heart and the functions of its electroconductive system. Among other things, an ECG can be used to measure the rate of rhythms of the heartbeats, the size and position of the heart chambers, the presence of any damage to the heart muscles, and the effects of heart drugs and other implanted pacemaker devices. Electrodes are actually conductive pads attached to the body's surface. Any pair of electrodes can measure the electrical potential difference between the two corresponding locations of attachments. This pair forms a lead. Each electrode actually consists of electrically conductive gel and a silver chloride conductor. The gel typically contains potassium chloride, sometimes silver chloride, to permit the electron conduction from the skin to the lead and then into the device. An ECG is an important tool used by many clinicians that can give important details about the heart.